Good morning, everyone. I'm going to take advantage of this natural lull in the conversation to get things underway. I hope you're all fed and watered. There's some amazing brownies making the rounds and delicious tea, so that's going to keep you all sustained. For those of you I haven't met, I'm Francesca Oakman-White. I'm the founder of the Beauty Triangle, and it's such a pleasure to host you here this morning at the gorgeous Cloud 12 in Notting Hill, so thank you, Jenya, for having us. Our focus this morning is womankind. I don't know about you, but the women that I know in my life are absolutely extraordinary. They're powerful, resilient, endlessly kind, and despite whatever life throws at them, they manage to retain this. I do, however, think that none of us is resilient enough to sort of cope with the effects of age, with hormones, with stress, and so this morning is really about taking a closer look at what we can do to, I suppose, take charge of our lives as time goes by, and also what we can do on the everyday to look after things like our skin, our hair, and our sexual health as time sort of evolves and life throws different things in our pathways. Before we get into that subject, a little bit about the Beauty Triangle. We started TBT as a way to educate and empower our audiences on all aspects of their health and well-being, and as many of you will know, always from a holistic standpoint. However, we also set it up as a way to introduce you to the most trusted, the most authoritative voices in the world of wellness. Which leads me very neatly onto our amazing panelists that we have here this morning. We're joined by aesthetic doctor and founder of Illuminate Skin Clinic, Dr. Sophie Shotter, by BARP's Vice President and aesthetic surgeon, Ms. Nora Nugent, and finally by Cloud 12's founder, herbalist, naturopath, so many other things, so many words to describe Jenya. I'll let her tell you more later, Jenya Di Pierro. And really they're here to discuss the means, from topical ingredients to proven technologies and treatments that can give us sort of physical and emotional confidence back once more. I'm going to stop talking now and pass over to these ladies to introduce themselves further, but you will hopefully have found a programme at your table place. There's an amazing sort of synopsis of every speaker that you're going to hear here today. Flip over and there's some sort of lines if you want to take any notes on anyone. You've got a little pencil there. And we've also left a referral card for you. So if you'd like us to connect you with anyone that you hear speak today, please just tick the box, leave your name, your email address, and we'll connect you after the event. I'm going to pass over to Sophie now. She's going to get things moving and then we will crack on with the conversation.
So thank you so much. It's lovely to be here today and beautiful venue. So my name's Sophie Shotter. I'm an aesthetic doctor, and as Francesca said, I have a clinic in Kent called Illuminate Skin Clinic, and I also have a practice on Harley Street. My real passion is helping predominantly women look and feel their best. So many of my patients are around an age where things are changing in terms of their health, their well-being. And so I also, probably about 7 years ago now, went off and trained in quite advanced hormone therapies in the States. And it's amazing to see how much things are developing over here now and how much the conversation's opened up around women's well-being. And so for me, the real passion is marrying great skin, great aesthetics, and inner health.
So thank you, Francesca, and again I echo thank you for having us here, and what a lovely venue. So I am Nora Nugent. I'm a plastic surgeon. I'm based in Tunbridge Wells at the Purity Bridge Clinic, and I'm Vice President of the British Association of Aesthetic Plastic Surgeons. And I came from a background of reconstructive and aesthetic plastic surgery, but my focus now is on aesthetic surgery. However, really it's an overlap, and I see so many people with many, many different reasons for plastic surgery. And actually it's a spectrum, and I find more and more we focus on finding where we sit on that spectrum and what can be done. And a little bit like Sophie, my focus is on really helping people to feel better, feel more confident, and improve or alter the part that is not quite fitting your own self-image. But it's not about vanity, it's not about turning someone into a different person, it's about finding the best version of you and what suits you and choice.
So that's what I focus on. Such a nice way to sum it all up, the best version of you. Thank you, Nora. And finally, Jenya.
Thank you, Francesca. It's always so inspirational for me to have these events and meet inspiring speakers and all the lovely ladies in the audience. My background is actually finance, so at some point in my life I was super busy flying around the world, my health was deteriorating, and I kind of thought that I want more balance, I want to fix my health, and also I want to age slower, and I don't want any of my friends or family to get chronically ill. And that's how I thought of an idea of creating a wellness club. about 5 years ago. We started with a spa, and then I was already studying naturopathy and was a herbalist, and idea grew bigger and bigger to include wellness clinic and then brasserie and the kids club downstairs. So everything we do is about wellness, but not just physical, emotional and mental, but also social. That's why we hold events like this, where like-minded women can meet each other, have fun, learn new things, and we've got kids club downstairs where parents can have quality time with their kids. So I'll stop there. And
no, that's really interesting. I love what you just said about social wellness, because it's an angle that I actually hadn't considered, but it's so critical for us sort of having the conversation that we're having today. And like you say, bringing people into this space to have these conversations out loud. It's always been the crux of what we do at the Beauty Triangle. So it seems like a very fitting time and place to be talking in this way. So everyone's introduced themselves. We'll get cracking with the main conversation. I should also say we'll have time for an audience Q&A at the very end. So we'll save the conversation, anything that you want to ask our amazing speakers until then. And we also have an amazing goodie bag for you to take away. So I'm sure you won't want to leave without that. We've got some incredible perimenopause sort of supplements, M Powder, who have very kindly given us sort of some literature and some product there to take away. And also Jenya's put an amazing hair tonic and tea. It's a sort of hybrid, isn't it? A hair tonic that you can drink as a tea.
Exactly. Right? So it's a hair tea with the herbs that stimulate hair growth that you can either drink or rinse your hair with. So works.
We're going to find out all about that later.
Yeah.
But first, Sophie Shotter, who is, she's introduced herself. She's an incredible aesthetic doctor. She has a very inside-out approach to skin health, which I find really refreshing in this day and age. But maybe, Sophie, we can sort of start with the basics. What do we do at this time of life to get our complexions back under control? Is it about switching up our skincare regimes? Is it about the ingredients we're using? Where do you start?
It all starts with skin. For me, it's, yes, I do aesthetics, and when I'm in clinic, most of my day is spent doing that. But actually, if you're not using good skincare at home, what's the point? And it is a time in our lives when for most women in our 40s, we start to notice our skin changing. Some people earlier, some people slightly later. And those changes can be really dramatic. And it's, I get so many women come through my door say, I never thought I'd come to see a doctor like you. But then in the last 2 years,
like you.
I know, lol, literally. But then in the last 2 years, I feel like I've aged 10 years, my face has changed so dramatically. And I will always start with what they're doing routine-wise. And yes, in some ways it can be a time for some women to start being a little bit more aggressive with skincare. And by that, I don't mean having downtime from skincare. That's not really necessary anymore in the way maybe it once was. But it's more about using the right active ingredients. But we also have to remember some women's skin changes the other way and becomes much more sensitive and can't tolerate what it used to. But a lot of the time, the thing I repeatedly hear is, I've had great skin my whole life, I've had a really good regime, but it's just not working for me anymore.
That's so true. And also I think women get to a stage emotionally where they think there are things that they're never going to do. I'm never going to do that. I mean, I said it, I'm never going to have injectables, and then look at me sort of a few years later on. But you know what I mean? Like people, they hit a certain stage of life and suddenly these things that, maybe they never considered are suddenly relevant because they can physically see the change manifesting, and they can feel that their skin and their sort of bodies are different to how they once were.
Exactly, and I think we now are aging so differently than we were. My grandmother was an old woman in her mid-50s. I remember, she behaved old, she looked old. We're not like that anymore. We take ownership of our aging process on every level. We're active, we're eating better, we're thinking about how we supplement, we're all of these things, and more things are becoming available to us. So why should we wake up feeling great and look in the mirror and think, it's marrying up how we look and how we feel?
And we're living longer as well, so why wouldn't you do it for sort of that greater longevity?
We have over a third of our lifespan potentially post-menopause.
But that's so interesting. And what is it that women are sort of saying are the things that concern them most when it comes to their face, their skin and their body when they sit in your consulting room, for example?
A lot of it, fine lines and wrinkles, and the fact that they very suddenly appear more dramatically, and then a real change in skin firmness. That's probably the big one. The way the skin feels changes.
And is that because of sort of estrogen? Is that hormonal fluctuations? Things just don't feel as sort of dense and plump and juicy as they once used to?
estrogen, every single tissue in a woman's body has estrogen receptors on it, every single tissue. And that includes your fibroblast cells, which are the ones responsible for making collagen and elastin, which keep our skin firm.
But that sadly slow down when you hit like 25 or something incredibly depressing. Yeah.
So from the age of 25 onwards, men and women were starting to lose about 1 to 1.5% of our collagen every year. When we hit perimenopause as a woman, we then lose 30% of our residual collagen within the first 5 years. And that's because their fibroblasts just don't have the estrogen to fuel them anymore, so they're just not working as well. And thereafter, the speed of loss is still quicker, it's 2 to 2.5%. So it really is a cliff edge moment. When women describe that, it really physically, for skin, is a cliff edge moment.
Why is it that we always refer to this like cliff analogy as women? It's always like menopause cliff, skin cliff. It's like we're sort of running and then we sort of aren't all of a sudden. I mean, you spoke earlier about sort of the use of injectables, and I think, you know, that you do some very clever things with them nowadays, very, very judiciously sort of used. They are obviously a very powerful means to make the women who sit in front of you feel more confident about their appearance. But how exactly for this patient cohort are you using things like toxin, filler, skin boosters? Because it's not just about sort of freezing expression and volumizing nowadays, is it?
Not at all. I mean, my patients actively come in and say, I don't want people to know I've had anything done. It should be your choice if anyone knows. So the difference is dramatic enough that you notice it and you feel better, and people pay you compliments such as, have you had a new haircut? You're looking great. Or have you been on holiday? You should look fresher and brighter. But when we're working more strategically, looking at what has changed, so for me, the key is thinking about every layer of the face that changes, because again, we lose bone, for example, as we age. And so as much as everything starts with skincare, if you don't also think about the fact that you're losing underlying bone, and for that, you know, from a non-surgical perspective, we are thinking about injectables and particularly fillers, and the fact that our muscle dynamics change and the strength of some muscles become stronger, some become weaker. It's about balancing every layer of the face, and that's what keeps us looking natural.
That's really interesting. And also I feel like the way that you're using injectables now is very much about promoting skin health. I mean, things like Profilo, skin boosters are absolutely flying, and it's not because anyone feels that they have a noticeable difference to their skin that people might comment on, but it's more that they feel healthier, their skin is plumper, it's denser, it's juicier, it's all of those things that you were saying earlier, estrogen, when it sort of falls off the cliff, you know, sort of leads to.
Yeah, absolutely. And we also, that space, I think, in the injectable sphere is the one where we'll notice most growth. So last year we launched Allergan launched a product which I was very involved in called Harmonica, which for me in that sort of perimenopausal age group is a game changer and is a real collagen stimulator, but with some gentle volume as well, but really about looking very natural. So I just turned 40 and I had some Harmonica in December just at the back of my jawline, and it's all about that laxity, which is now pretty much gone, but was definitely there. So for me it was about getting in there and using it preventatively, but that I think is a really big treatment amongst that age group at the moment.
Yeah, definitely. The collagen stimulation seems to be sort of really making sort of gains at the moment. And talking about collagen stimulating, you obviously do a huge amount with the machines as well. So, you know, marrying those injectables with the more energy-based devices, which is nice because not everyone wants to go down the injectables route, but also I think we always talk about a synergistic approach. You know, we get great long-term effects with skin health and with aesthetic goals when we sort of do a little bit of everything, right?
Exactly. There is no one magic bullet. I wish there was. I wish I could say, here, take this pill, it's going to do everything, or have this treatment, it will do all you need. It is exactly about that, looking at the face in front of us and doing a little bit of everything that's needed rather than too much of any one thing. So for me, devices, and I mean, we use Softwave, and we use the Profound RF, which is a radio frequency microneedling treatment. They're kind of our big collagen stimulating treatments that we use.
And Softwave is ultrasound.
Ultrasound based, yeah. And they're both fantastic. And it is about every person is different. Some people don't want to have injectables, and provided people then understand the limitations. So for example, if someone comes to me and says, I really don't like my marionette lines, but doesn't want to have fillers and doesn't want to have a facelift, we might be able to do something with some skin tightening, but there'll be a ceiling on what we can achieve. And so it's always about, I never overpromise and underdeliver. It's always about being honest and saying, that's fine, but this is what we can get to.
And the results are going to be more gradual. You know, we sometimes look at these energy-based devices, and some of them take upwards of, 3 months, 6 months,
Exactly.
even up to 18 months with certain devices to actually see the results. And so,
It's a journey.
Yeah, that's definitely why it's called a treatment journey. That's so true. Tell me a little bit about hair loss, because that's something we wanted to touch on today as well. Is that something that you're seeing more in your clinics? Is that something women are coming to you with as a concern?
Yeah, very much so. And I think actually more women than men experience hair thinning by the age of 60.
Really?
But of course in men, hair thinning is kind of deemed socially acceptable. It's something that happens, whereas in women it's a huge confidence thing.
Isn't it so funny? Men don't like to talk about many aesthetic concerns, but they all, like I sit with sort of plenty of like my husband's friends, and they all talk about their sort of bald patches and their receding hairlines. You'd never get them talking the same way about their crow's feet, or that the lines on their forehead. Women, it's the complete opposite.
Yeah.
We're very happy to point out all of our lines and wrinkles and the things we really dislike about our bodies, but we don't always talk about our hair.
No, and it's up to 80% of women by the age of 60 have experienced some hair thinning.
Yeah.
Which can be to do with nutritional things, it can be to do with health problems, it can be to do with hormones. It can be to do with how you style your hair. There's so many different factors. But I think the great thing is we're all becoming so much more aware that there are options. And so actually when people have read, I've read that you might be able to do something for hair loss, they ask about it. And that knowledge is power, and then we can explore what's doable.
And I know Jenny's going to talk to us a bit later about her sort of remedies for hair loss, but what do you find yourself most commonly sort of promoting in clinic as something that's a really sort of valuable help for women sort of experiencing hair loss or thinning?
So we actually do quite a lot of genetic testing around hair loss. So a little cheek swab that's sent off to a laboratory, and this is in combination with a medical history and potentially blood testing to check for other things. But it can tell us what's driving genetically, what's most likely to be driving your hair loss. And then we can be targeted about, for example, some of the therapies, the prescription therapies that people can use don't work for everyone. And this can guide us whether that's likely to work for you, or whether it might work but you need a higher dosage than the next woman. So we can be quite targeted with it. And then we'll combine that in clinic with things like microneedling growth factors or stem cells or platelet-rich plasma, which is PRP. And
so
that
taking the blood, spinning it down, getting the growth factors out.
Exactly. Using your own body to kind of, the power of your own body to stimulate a particular area.
I think that's such a lovely concept at this stage of life to be talking about as well, using, because I don't know, it can feel like we're so often talking about a loss of power at this stage of life, and actually it's worth remembering that our bodies are incredible vehicles and machines, and they have so much natural power within them that we can use to regenerate. What are your feelings on hormones? You said that you sort of offer, or in fact you trained quite extensively in sort of hormonal therapies. Is that something that you see a lot of women who pass through your clinic doors opting for? Does it help?
I think I'm a massive advocate of it. It's just because menopause is a natural process doesn't make it a healthy one. And as a rule of thumb, a third of women will sail through menopause with very few problems. A third will have a torrid time, and a third will have problems, but they're kind of manageable. Now, within 5 years of perimenopause, our heart attack risk catches up with amounts. With it, the bone density impact of no estrogen, it isn't actually good for our health. So take out of the equation anything else from a health perspective, menopause is not a good process for us. Now, there's some really exciting research happening in the States mainly, which could make menopause a thing of the past. Now, I think that raises interesting ethical dilemmas as well within 10 years. Around other hormones that might become available. And I think it's really interesting to see that happening. I will absolutely take hormones when I need to, but I also respect the fact that not every woman wants to. And there are other things that can be done. There are things you can do nutritionally. And I think it's so important to work on a spectrum. Nutritionists, naturopaths, doctors, we all kind of have different solutions that will work for everyone. But for me, I think the important thing is women shouldn't suffer.
Yeah, that's so true. And again, to your point, different doctors, different practitioners advocate different skill sets and I suppose sort of methods for doing these things. But I think if we consider a 360-degree approach, which is very much sort of what you channel in your clinic, that's when we get sort of really amazing long-term results.
Exactly.
I mean, you do a lot with supplements, don't
Yeah.
you? And you have this sort of very investigative approach, I think, to your patients and how they're aging. So where does that fit in, sort of finally, as that part on their journey?
Supplements can do so much, and again, there's some really exciting stuff coming supplement-wise over the next few years, are already available. So things like NAD+, I think, is an amazing supplement for women to be on, and that's kind of part of your cellular energy currency. And taking that, you can't actually take it directly, but you can take things that increase your body's availability of it, boosts your mental and your physical energy. There's a supplement called spermidine, nothing to do with sperm, which increases your body's, it activates something called autophagy, which is basically your body's ability to get rid of defunct cells, which can become problematic and certainly aren't doing anything useful.
It's the same thing that intermittent fasting triggers, isn't it?
Exactly.
That sort of just ridding of the dead wood in your cellular system, I suppose.
Yeah, and all of these things can really help us age well. And as a bare minimum, we should all be taking vitamin D. It's important for everyone, men and women, but no matter how much you're outside, between September and May, the UVB rays in the UK are not strong enough for your skin cells to make any vitamin D. So we should all be taking that, and probably at much higher doses than most people realise. Magnesium for women, so important.
From a sort of relaxation, from a sleep perspective, or?
Sleep becomes a huge problem for so many women.
Yeah.
And again, that links to how we feel. If you're not sleeping well, everything else becomes more problematic. But also it's an important cofactor for so many reactions in the body. So magnesium, I think, for women is a real mainstay as well.
And it's really interesting, because I think when perimenopause, when menopause starts to manifest, sleep is often the first thing that women find themselves talking about, and it's probably the last thing that you'd expect somebody to come to a doctor like you, to paraphrase from earlier, but it's actually probably a very relevant part of the conversation.
Absolutely.
Isn't it? All these things impact on how we look and feel every single day.
Because a lack of sleep is one of the worst things for us. So take everything else to do with menopause out of the equation. If you're not sleeping well for whatever reason, you are going to age quicker inside and out.
My God, 8-month-old baby. I'm like,
sorry, Fran.
No, I totally agree with you. It definitely has an impact.
It's brutal. And so many women who struggle, they come in anxious, they're depressed, they're just not coping with the stresses of their life in the way they used to. And yes, there are direct hormonal reasons for that, but a lack of sleep compounds everything.
Yeah, that's so true. Get a good night's sleep, guys, everyone. And thank you so much, Sophie. That was super interesting. I feel like we covered so much ground. But yes, onwards to Ms. Nora Nugent. She's introduced herself. She's the Vice President of BARPS. I'm glad you spelt out what that was earlier, because I always get all these words in a muddle. She's also really renowned for her very restorative procedures, face, body, everything sort of down below. Nora is your lady. And she also has a wonderful sense of empathy, which I'm sure will come through as you hear her speak today. But Nora, maybe you can just sort of set the scene. What are the women who, I suppose, predominantly approaching midlife are coming to see you about with regards to face and body?
So it's partly some of the same things that Sophie mentioned, but my focus is surgery. So obviously I see people coming in wanting slightly different things. From a facial point of view, the overwhelming, I guess, theme is that people feel that they look tired, or that they look cross, but they feel fine, and they're constantly tired of being told cheer up, or what's wrong, when nothing's wrong. And
it's when the physical doesn't reflect the emotional.
Exactly,
the
they look in the mirror and don't see themselves. They don't look how they feel. And people don't want to look different or have a different identity. And I'm afraid there's a hangover about facelifts, for example, from times gone by, and also the sort of stereotypical over-pulled look. But that's really not the case anymore, and facelifts can be a very natural part. And that will be my focus in terms of facial work. I do skincare as well, and some injectables, but really it's facelift surgery that I focus on. And what I would say is that there are lots of people walking around who have had facelifts that you don't know about. You only pick out the bad facelift. There are many, many people walking around who've had facelifts and look very well, but
true.
They look well, not operated on.
Yeah.
And I see people coming in who want to look better, not 20 again, nobody comes in looking for that, not overdone. There is the odd group of patients who want a very extreme change, but most people don't. Most people, as Sophie said, don't want to look like they've had anything done. They want it to be up to them to let people know if they want to.
Yeah, and like you said earlier when you introduced yourself, it's about the best version of yourself.
So from a facial point of view, it really is. And we're moving on from this sort of old-fashioned facelift now. We're looking towards all the layers of the face. It's not just the face and the underlying support layer anymore. It's adding fat, taking away fat, looking at salivary glands that can cause a bulge in the neck. Lots of different things have crept into facelift surgery.
And how often does the conversation then turn to body? Do most women sort of find you because it's something facially that bothers them, or do you also see them coming in for sort of breast work, body work?
A mixture of everything really. So from a breast point of view, again, menopause affects breast. It's hormonal tissue, so breasts can get bigger, breasts can get smaller at menopause, but it's what people notice is a change. You know, they might have always had large breasts, but at menopause their breasts have become larger, or they may have lost some volume after pregnancy and breastfeeding, and then menopause comes along and they lose more volume.
And to Sophie's point earlier about the firmness and the density and the skin
and the
quality
skin changes as well.
Yes,
so from a breast point of view, there are a lot of changes around menopause. And the other group I see for breast surgery are those who've had breast implants put in their 20s or 30s. And it's now time to change those implants, either because the implant has changed or because their breast has changed over the implant, or sometimes they no longer want implants as a different
or
stage of
aesthetic
life.
reasons have changed as well. You know, sometimes I don't know, you can sort of want a certain shape and image at a certain age, and then in later life, you know, your ideology changes about what you want your breasts to look like. Exactly.
You know, and you can choose to have breast implants taken out just as you can choose to have them put in. So for breasts, those are the reasons. Body, a little bit different. Sometimes it's the aftermath of pregnancy really, but until later on people have not had time to focus on themselves. Life has been busy, there's always been something going on with the children, maybe finances weren't in order because of schools and so on, and now is the chance to do something for themselves. Sometimes it is menopause. You know, weight patterns change around menopause, skin changes again around menopause, so sometimes your body changes as well. So it's really a whole mixture of reasons.
And there's always that sort of term that I hate, which is that sort of hormonal belt that women often talk about as well. So you must certainly see, you know, women at a sort of certain stage of life coming to you for those procedures that address that.
Metabolism changes and hormones change everything as well. As Sophie mentioned, all tissue has hormone, in fact every tissue in the human body has hormone receptors, and some places are obviously more hormonally receptive, for example breast tissue, but actually everywhere is hormonally responsive tissue.
And do you find that women sort of struggle with doing something that seems so physical, from a psychological point of view? Like you said, sort of often children are there, you've got school fees to think about. Often the women that I speak to feel a real sense of almost guilt that they're prioritising this at this stage of life.
Well, it's a combination of guilt and feeling judgment, because people still feel very judged by having anything that could be deemed plastic surgery.
Yeah, it's so true. It's still whispered.
So yeah, exactly. It's a combination of guilt that they're spending all this money and time on something purely for themselves when maybe they've previously focused on family. It's fear of being judged, because although there's nothing wrong with it, it's still relatively taboo to openly discuss some things. And it's combined with actually still a sense of wanting to have it done, because it's impacting so much. It really affects body image and self-confidence and self-image.
How long do you find women actually contemplating procedures like these before they end up with you and on your table?
Usually actually at least 5 years, but quite often longer. Sometimes 10 years, and actually sometimes it's changes of later life on top of something that has always concerned them or they've always been aware of.
Yeah, that's so true. And do you find that sort of women who I suppose are undergoing hormonal support, hormonal therapy, are they in a state where they feel a bit more resilient to these changes that are going through their body, or are they sort of still finding it difficult to manage?
More resilient in the sense that the physical symptoms of menopause are more controlled. So Sophie said sleep effects. Everything's worse if you can't sleep.
Yeah, exactly.
Everything's worse if you're getting hot flushes, if you're not feeling well, if you're not feeling yourself. But some of the physical changes won't be improved by HRT, and that's where I come in. So I guess hormonal balance is very important, because the better you feel going into something, the more resilient you are physically and psychologically.
Yeah, that's so true.
And the easier a recovery you have. And I also use the analogy that when we're doing a facelift, I'm physically lifting and repositioning the face to where it used to be. But the skin is also important. I'm not changing the surface of the skin. So that's where skincare comes in. But for breast and body surgeries, the equivalent would be hormonal balance. I'm physically lifting or reshaping or enlarging or making smaller, but hormonal balance is part of the physiology of the tissue. So it's a combined approach, as usual. That's always best.
That's so interesting. So actually what you're doing superficially on the outside is really determine the results almost of what you're doing to look after the inside as well.
Yes, it's all tied in together.
Yeah, that's so true. For those entering their sort of second spring, what are the procedures that are most in demand when we're talking about the perimenopausal or the menopausal women? What do you frequently find yourself actually sort of doing with them?
So facelift surgery, breast lift surgery, and I guess breast lift combined, I probably do more breast reductions than putting in implants in that age group. But breast lift with or without a reduction, and abdominoplasty are probably the three most common, and then followed by eyelid surgery and labiaplasty. Sounds an odd mix, but that's
but how interesting to know that the areas as well that we start all sort of really looking at.
Yeah.
And what can you do to help a woman sort of prepare for these surgical procedures that she might be going through? I mean, physically as well as emotionally. What can she be doing herself as her homework, I suppose? So
if you divide it into physically and psychologically, so psychologically, actually thinking clearly about what you don't like and what you want. And I try and get people to focus on what are you concerned about rather than what procedure do you want. Because it's not always the same answer for both.
And it's really nice as well, because it takes it away from being that transactional surface level. Actually, it's about addressing that sort of deeper rooted emotional want for wanting something.
And then from my point of view, because surgery is still surgery, some things are smaller surgeries, some things are actually quite big and take all day. It's also how much are you prepared to put into it, and I mean that in every sense. Time, recovery, finances, degree of change. But while, like we've said about facelifts, having moved on from the old-fashioned facelift, there's still a recovery time, and if you have an extensive facelift, the first couple of weeks you will look exactly like what you told me you didn't want.
Yes, exactly. Be prepared for that
tight, and it will feel very tight. So it's about how much are you actually prepared to put into it. There's no right or wrong answer. It's not for everyone, but some things need a lot of input. And so psychologically, those are the things to consider. And what kind of changes do you want? Because not everyone needs every aspect of a particular procedure, or it can be tweaked to focus more on one change than another, even though it's this, you're having the same procedure as someone else, you can have a different outcome.
Yeah, that's true, because we're all so unique as well.
And then physically, the better a condition you are having your surgery, the better a result you will get afterwards, and the easier the recovery in general.
So is that things like supplementation, nutrition?
Nutrition, supplementation, physical health, activity. So someone who is very active, who's at a steady weight, and a weight that's in the healthy range for their body, and who has a good nutrition, comes in at a much better baseline for a big surgery than someone who isn't.
Exactly.
And then you can still up that by some supplements in the run-up to surgery and immediate aftermath, after surgery, lymphatic massage, drainages, things like that.
Lymphatic drainage is amazing as a tool for recovery, isn't it? You've always been very passionate about this.
Yeah, I think it makes a big difference, actually. And these are the things you can do to optimise. And also, socially, you need to work out how to deal with life around the surgery. Work, children, pets, friends. You need to work out what you can do, what you can't do, what needs to be taken care of, and who you want to involve. Because sometimes it's almost nobody, but everybody for a big surgery needs someone around.
I was going to say, you must see it being beneficial that women have a bit of a support, somebody to lean on when they're going through this. These are big surgeries sometimes.
But it's deciding who. So you want someone who will help out practically,
Yeah.
but who will also support emotionally.
Yeah, that's
And
so true.
you absolutely do not want someone who is either judgmental or who is picking on the small things,
Yeah.
because nothing will look perfect in the recovery period.
That's
So
the
a
last
lot.
thing things are ever going
It doesn't
to be
help.
is perfect.
It doesn't help when you've invested a huge amount into surgery and someone is looking at you, go, "Ooh, what about this?"
Yeah, exactly.
When there's nothing wrong.
Yeah, exactly. And you're also an absolute specialist when it comes to labiaplasty. So tell us where sort of sexual health fits into this sort of journey that you see women go on.
So it's a mixture of body confidence and physical comfort. Again, hormonally responsive tissue. It can change after pregnancy, it can change after menopause. The usual changes of menopause would be that tissue can be a bit drier. You get what we call atrophy, where the tissue is not as firm, not as plump. And all of that can impact on sexual confidence and comfort during intimate relations as well. So both can impact equally, actually. And labiaplasty is a physical solution, but a good solution for the physical discomfort aspect, but also body confidence. And combine that with getting the right hormonal balance, and both help.
Yeah. And how does that sort of conversation come up? Do people sort of come to your door with this, or is it sort of a conversation? Because it is such an intimate sort of part of our bodies to speak about with somebody who we don't know per se.
It's probably the one area of my practice where most women come in specifically wanting a female surgeon.
Yes, that's so true.
You might think maybe for breast surgery that would be the case, but actually for the majority it's not really for breast, face or body, but it is for labiaplasty. And quite often they specifically come to a female surgeon because they feel they can talk more openly about it. And actually I need to understand the reasons behind the labiaplasty to know whether it will solve the problem or not.
Exactly.
So usually it's a fairly open conversation. For some existing patients, it's sort of in the aftermath of another procedure. So they've become comfortable with me having something else done, and it comes up in one of the follow-up consultations. But for a lot of women, they've deliberately chosen a female surgeon so that they can feel comfortable talking about it.
That makes perfect sense. And what is the downtime? Sort of how long does it take to recover from a labiaplasty?
So almost everything I do, the rough answer is 6 weeks. But but the first week, I tell people from a labiaplasty point of view that the first week or two will be quite uncomfortable. It varies from person to person. By the end of the first week, you notice you are definitely more comfortable and it's easier, a lot easier. By the end of the second week, most people are quite comfortable for day-to-day life, but not exercise. 4 weeks for most exercise, swimming, running, tennis, that kind of thing. 6 weeks for anything that involves direct pressure on the area. So that's cycling, horse riding, intercourse. So those are the broad recovery patterns, and there's sort of a specific hygiene regime. And
fair enough. It's so interesting because face aside, a lot of the surgeries that you do are sort of the things that we keep under wraps, but I bet they have such a massive impact on women's confidence overall.
Yes, and actually sometimes it's physical comfort as well, because if we're talking about menopause, often labia become dry and therefore it's not very comfortable in some underwear, in some styles of clothing. So it's physical comfort and body confidence.
Are there
actually
any
body confidence goes a long way in labiaplasty surgery.
Yeah, exactly. And are there any other options, surgery aside, for sort of vaginal rejuvenation?
Yes, so there are devices for vaginal rejuvenation and labia rejuvenation as well. I tend to focus on the surgical aspect, but there are treatments like radiofrequency and laser as well that can tighten skin and that can help with collagen stimulation in the area as well.
And even sort of injections of fat sometimes.
Injections of fat, which tend to be more for the labia majora, the outer labia, which can deflate with aging changes and hormonal changes. So inner labia or labia minora, I tend to reduce. Labia majora, I sometimes reduce, but actually more often add in fat to plump it up. You can do fillers there, but I have to say I'm not overly keen on that area for fillers.
Really? That's interesting.
No, not really. So I would either tend to leave it alone or add fat.
And again, it's using your own, your body's own resources, like we were saying with the sort of, blood, the regenerative medicine, the PRP. It's a nice way to sort of use your own body.
And there are fillers that are specifically designed for that area, but honestly I don't use them.
Agreed. And final question, how as women do you think we can sort of take back control on the everyday when it comes to this this sort of time of flux, sort of approaching perimenopause, menopause, even when we're sort of just going through a very stressful period of life, what can we be doing on the everyday?
So I think the first thing to realise is that we're all in the same situation to some extent.
Yeah,
We'll,
exactly.
You know,
Solidarity,
all of us,
we're going
if
through
we
the
live
same
long
thing.
enough, will hit menopause.
Yeah, so true.
And as Sophie said, now we live a lot longer after menopause. In times past, menopause was towards the end of your life. Now it's in the middle.
Yeah.
So
and it's also at a time where we're sort of feeling like we're flying on all sort of fronts, right? Sort of professionally, personally. We're getting married later. We're having children later. There's a lot that's sort of been crammed into that middle part of life now.
So I think it's first of all realising that it is a normal part of life. That doesn't mean it can't be made better or altered, but it is a normal part of life that will affect every woman who lives long enough. And therefore it's about looking at how it affects us and what we can do about it. And I think being open to noticing what's changing and what's beneficial to change as well, and looking into what your options are.
It's true. Not
everyone has to do everything, but it's what I think it's realizing there's a choice and there are options out there, and being active about looking into what can be done.
Yeah, exactly. Sort of educating yourself on the available options. And Nora, that was really interesting. Thank you so much. And any questions that you have for Nora, we'll sort of have the Q&A at the end. Thank you. Our final speaker is the amazing Jenya Di Pierro. She's the founder of this beautiful space that we're all sat in. As I said earlier, she is a woman of many talents, predominantly sort of focusing around natural alternative medicines, plants, herbs, supplementation. She really is a font of knowledge. But Jenya, maybe you could just start by explaining, as time goes by, what are the changes that bring women to your door? What are the women that you see sort of seeing you for?
So I do focus on hormonal and immune health in my practice.
Yeah.
Having said that, kind of work of naturopath is slightly different from work of a doctor who would specialize in some kind of particular pathology, and the focus would be kind of quite narrow. As a naturopath, you have to look at kind of every aspect of health. So when we talk about pillars of health, it would be good diet, herbs, supplements, sleep, stress reduction, exercise, love and care. And then we've got our negative factors on the other side, such as toxins and infections and bad diet and lack of sleep and stress.
Yeah.
And so essentially people can come with almost anything, because the first thing I would do is I would look at this positive and negative factors, and I try to remove as many negatives as I can and add as many positives as I can, and that would give body this ability to self-heal and self-rebalance. I can tell you a lot of symptoms go away with just implementing that strategy.
That's such a clever strategy, because when I think about sort of everything that you've just spoken about, it seems overwhelming. Like there are so many things to think about, but actually just writing up that list almost, like the things you want, the things you don't, and trying to alter the balance is really smart.
Yeah, and that's actually the biggest challenge for me, because I don't have a magic pill, and I need to educate my clients that it is a process, 3 months or longer, of sometimes changing lifelong habits. But you know, I kind of practice what I preach, and when I hit 45, my skin actually got better. So I used to have breakouts and I used to travel a lot, so it looked quite dull. And then I started seeing all these patients in clinic that I would myself kind of relate to, because you don't have time to treat yourself, you know, that's always
you're always at the bottom of the pile, sadly.
But then you helping someone that you can kind of relate to, and then you started implementing these things, and all of a sudden my breakouts went, my skin got plumper. Well, I also happen to be one of those women who have estrogen surge before menopause. So in the perimenopausal kind of world, sometimes you experience this kind of estrogen dominance, which is good for my skin. So, but at the same time, you know, I am pretty much looking after all of these things that I mentioned, that I can see results in my body and in my patients.
Yeah. Well, I suppose so many doctors sort of say how they try every machine or every treatment that comes their way so that they can, you know, actively tell their patients about it. But for you, you're sort of living and breathing, you know, what you do for your clients as well.
Yeah, I'm not super adventurous. I haven't tried anything invasive yet, or you know,
the right company when you come to.
Yes, exactly. I need to know the top specialists, and what I do right now are machines that are non-invasive, so they can be very tiny needles. that give you a little bit of an extra boost.
Yeah, exactly.
And a lot of supplements, a lot of herbs.
So aside from skin, are there other sort of conditions that you find women, you know, of your age or your sort of regular clients, what are the things that are bothering them most?
Yeah, so of course a lot of menopausal patients, and I have a slightly different view on menopause. I actually think it's a beautiful thing.
Yeah, and it's lovely. I think we need to have the balance when we talk about menopause as well.
Yeah, it's kind of a transition to becoming a matriarch.
Yes.
Who's in charge of their destiny, you know, to get their energy back, and it is a painful period. So in some way it's like birth, which is a painful process, but then you come out to a beautiful world on the other side.
Yeah.
So I'm kind of almost excited about going through menopause, but ask me a few years later, let's see what happens to my body.
I'll come back to you on that one.
Yeah, also women with other hormonal disorders like endometriosis and polycystic ovarian syndrome. Herbs are amazing actually at supporting some of those imbalances. And actually, as one of the symptoms is the hair loss that would be triggered by some of those imbalances.
Is it just sort of menopause and sort of hormonal imbalance that's causing hair loss, or do you find, I don't know, sort of stress, underlying immunity, things like that also being contributing factors nowadays?
Yeah, actually it's more androgen excess, which is kind of excess of active form of testosterone.
Yeah.
That is the main kind of reason behind some of the alopecias and some other kind of hair loss related imbalances in men and women. So, you know, naturopathically we will be looking for those herbs and supplements that inhibit an enzyme which activates testosterone to convert to its kind of, let's say, harmful form when it's in excess. And then menopause, on the other hand, is related to drop in estrogen that is also related to hair loss.
Yeah.
And then we've got thyroid disorders like hypothyroidism that drives it. And then we've got some metabolic disorders like diabetes and sugar imbalances that can also drive hair loss. So,
a lot of factors going on that sort of relate to our hair.
So exactly. So a lot of hormonal issues, but in addition to that, you can absolutely have stress-related problems. And you know, when we talk about stress, it's not just stress at work or relationships. Surgery can be a stress. Harsh diets can be a stress. You know, some kind of disruptive events in life,
things that
moving
take
a
your body
house
out of its
actually
comfort
can
zone.
trigger a lot.
Exactly.
And the refurbishment that comes with it, because it's actually a quite toxic process. So once you have a lot of those toxins, then oxidative stress goes up.
Yeah, and emotional upheaval as well. You know, death, illness,
Absolutely.
loss. You know, in sort of so many different ways. That's when it can really hit sort of women quite hard.
Yeah.
COVID as well. I mean, not to dwell on sort of times gone by, but I think it's still a relevant point.
Exactly. So some of the problems also with thyroid and you know, some types of alopecia, they're actually related to immune system. And long COVID infections, even high fever, it can trigger hair loss. That's more kind of temporary, but in some cases it's you know, 6 to 9 months, so it's quite a long time to
if you're
to
waiting
go
for
through
that
it,
hair cycle,
and
it's,
you know, you're in this mindset that it will only get worse. So mentally it can be a horrendous period.
It's funny, isn't it? Because I think something like hair loss, you immediately think, what have I done today? What did I do yesterday? But it's often something that happened even 3 months ago, you know, when you have to wait for your hair to go through that growth cycle to actually see the results of, you know, when the hair will fall out.
Yes, exactly. It's about 3 months for this telogen phase of the kind of resting phase for the follicle to turn into its active phase. So whatever you're doing, you have to be patient for at least 3 months. Until you see any results.
Yeah, exactly. And it's so interesting. I think you and I spoke about this just before the talk, but you know, all of these things that affect sort of hair, skin, nails, that they're actually the last thing sometimes, aren't they, that the body prioritizes as I suppose sort of its workings. So actually sometimes it's even a reflection of something having gone wrong somewhere else in the body when we start to experience that hair loss.
Yeah, exactly. So for me, hair and, well, skin health, that's just a diagnostic tool to take a look at a client and then try and kind of untangle the causes of it. And so often causes somewhere else, whether it's liver or gut health or hormonal disorders. And actually quite often is the first thing that goes out of balance. And if you ignore it long enough, that organ that might have been the cause, that it can get a more serious problem down the line. So it's actually also just a good indicator for us. If something happens, we need to do a bit of an investigation. We need to look at our nutrients and lifestyle and things like that to understand what is the deeper cause of it.
Definitely. And also you must be having such a psychological impact on the women that sit in front of you as well. Like our hair is massively linked to our confidence, isn't it?
Yes, exactly. I have to say, I just kind of finished 3-year diploma in homeopathy, and I'm super excited about it because I don't know if you know, but homeopathy essentially uses the energy of plants and some other substances to facilitate this kind of self-healing in the body. It's not, there's not a whole lot of scientific evidence, but it's been used for 200 years. And actually, royal family uses it as a primary kind of way to maintain their health.
That's fascinating.
Yeah, so just to kind of do a plug that there's some serious people behind it.
Yeah.
But anyway, what I find is that there's no other modality that can kind of shift mental, emotional trauma. Or, you have some people who have been sick for a really long time, 8 to 10 years, and their vital force is so low. So you might be giving them supplements or herbs or what have you, but they're not even assimilating it so well. They're so depleted that it's just so difficult to kind of get them back to strength. And that's when homeopathy comes in, where it can energetically kind of help facilitate that shift.
Yeah.
And especially helping with mental emotional trauma, because the other way to deal with it is kind of 20 years of therapy. So for me, combining that energetic tool with everything I do with the actual phytochemicals and herbs and supplement diet is actually a priceless kind of last piece of the puzzle.
It's so bespoke, obviously, to the patient who sits in front of you. How are you delivering it? It's sort of like little sort of pills and tinctures.
Yes. So I do an assessment. So in homeopathy, you're kind of trying to get a kind of emotional, mental, physical footprint of a person, analyzing a variety of different symptoms, and you try to find the remedy that kind of matches that state.
Yeah.
And essentially, chemically speaking, it's just sugar and water, and it's a sugar peel with the traces of those kind of chemicals, but you can't actually see anything under the microscope. So it's the energy of that substance that facilitates that shift. And
do you
honestly,
see
because I worked in quant finance, I've got kind of a scientific mind. So coming into this, it took me a while, and I was amazed.
Come around to it as a concept.
Yes, so my kind of scientific brain tried to analyze and slice and dice and all of that. And in the end of the day, it's just practicing it and seeing those miracle transformations that made me a believer.
I suppose there's not always data. I mean, there are so many different schools of medicine and sort of practicing, and there's not always data in a lot of it to understand sort of whether it's actually having it, particularly with things like homeopathy, I suppose, sort of traditional Chinese medicine. A lot of the time it is about how it makes us feel, but maybe that's a very powerful medicine as well.
It is. It's a big challenge for a naturopath, but actually with regards to hair loss and some hormonal imbalances like menopause, there's tons of research. But having said that, because you look at a variety of different causes, so one person presenting with the same symptom of hot flushes or hair loss or other imbalances, actually the cause would be different, so the treatment would be different. So we actually can't do kind of clinical trials using this one herb for this one thing.
Yes, because you don't always know what's caused it in the woman.
It's not going to be the same.
Yeah.
So natural medicine does struggle with trials. Having said that, I do always check. I still love a bit of data
and
to
what,
support what I do.
What are you doing at the moment in terms of, you've got your amazing hair tonic tea that's gone into our sort of goodie bags. That's obviously something that you use as a solution to hair loss. You've also got a new package with a new program with microneedling and things like that going into it.
Yeah, it was actually Dr. Galina who kept asking me to create a tonic for hair, and I kept saying that, sorry, I can't just do that. There's not like one mix that will help you. Having said that, I've done the research and I've created almost kind of 10 different protocols for those 10 different reasons that can be driving hair loss. And the tea is, well, it is a little bit generic, of course, especially when it comes to hormonal health. I can't just kind of throw herbs at people. They are medicine, after all.
They're very powerful medicine as well.
Yes, exactly. So you always need to talk to a person and create something kind of personalized. Having said that, there are well-known herbs like nettle. So nettle is a herb which is coming out in a few weeks' time. Is incredible. I advise, if you have a garden, do grow it. It's the most nutritious kind of early spring herb that you can get to kind of support your body back after a little bit of depletion in winter.
I was laughing at Jenya saying she's the only one that's excited for nettles to come into the garden.
Gosh, I was once a gardener came and like took out all of my nettles. I was in tears. I had all of my weeds that I was using in my dishes.
Yeah.
And they just got rid of it. I literally cried.
Like, I've been growing those all year.
Yes. Thank God they're weeds, so they regrow pretty quickly.
Yeah, that's so true.
That's how nature supports us. It gives us in abundance what we really need the most. And nettle comes out in spring, being a natural antihistamine as well. So it's good for hay fevers as a side kind of.
But you boil it down and you make a tea out of it.
Yeah, so essentially, with any herbs, also the tea that I've given you that contains nettle and calendula, which is healing for the scalp, and equisetum, it's a Latin name, sorry, common name, we'll come back to, horsetail.
Horsetail, yeah.
Which is full of silica, so when you use it topically, it will give you this beautiful shine as well. So all of these herbs, they stimulate hair growth. They also work on some of those enzymes that activate the testosterone that we don't want. So there's 5-alpha reductase that it inhibits. Yes, and essentially with most herbs, you need to basically put in hot water for over 10 minutes or overnight. That's kind of how you extract the phytochemicals from it. And leaves are the easiest. If you've got roots, and then you need to do a decoction, which is like boiling it, so simmering for over 10 minutes. Or you can have tinctures, which is an alcohol extraction method, which is actually my preferred one, because alcohol is an excellent carrier. Kind of goes directly into the bloodstream. We don't need to spend much energy metabolizing it.
Yeah, exactly.
So it tends to act a little bit faster, but nevertheless, tea is also kind of powerful way of how herbal medicine practitioners support people's health.
Absolutely. So you have that, and then in combination you have your microneedling, and was there some electric
therapy?
Yeah.
So essentially, I researched all methods that can support also topically, and that they're not that invasive. So microneedling is one of them. Another one is LED. So light therapy, which also supports kind of cell regeneration and hair growth. And high frequency kind of microcurrent.
And how frequently should somebody be sort of doing this program? Is it a one-off? Is it something they have to sort of book in for on a regular basis?
Yeah, so again, depending on severity in the course. So some of those courses that we mentioned, they're kind of short-lived, and some would take longer. But the trials for all of this kind of microneedling devices and LED and so on, they stipulate about once a week for the period of 4 to 6 weeks.
Okay. So it's something that you sort of commit to as a little bit of a journey.
Yeah, so you commit and you do those procedures. You will possibly need to change your diet and remove some of the inflammatory stuff that drives inflammation, and immune system being at the core of it.
What are those things that you sort of find leading to that inflammation that is sort of driving, like things that we're sort of ingesting ourselves every day without realizing?
Yeah, so a whole lot of kind of anti-inflammatory foods and processed foods, so kind of deep fried stuff. Also, a lot of chemicals that are hormone disruptors that can be driving imbalances in hormones. So, also plastics and all sorts of containers, hidden plastics. So I know
you were telling me once about soup. You should never buy pre-made soup because it's gone into the plastic pots while it's been hot and it's released plastic.
Exactly.
That stayed with me forever.
Yeah, anything made in a factory. And obviously when it's hot, there's high chance of contamination. So it would go through some sort of plastic tubes during the process of preparation. It might be even dispensed into that plastic container while it's still hot. So all of that kind of increases the chance of getting those xenoestrogens, so kind of hormone disruptors, into your food. Water as well. In London, unfortunately, it's quite toxic. So we always need to use filtration methods, such as reverse osmosis. Brita filter doesn't do anything.
Really?
I've tested it.
Okay.
Yeah, it's pretty useless in my opinion. But yeah, so we need to take care of all of those environmental toxins in our food. Also in terms of nutrients, so iron is related to halos in some cases, so you'd want to have your ferritin of 50 or above, which is not always easy for women who are menstruating because some of them lose a lot of blood. So in cases of endometriosis, for example, that's something we'll need to deal with, working with the cause of it.
And what then is it about taking then a supplement
so
to
you
try
can
and
supplement. Iron is a little bit harsh on the gut, but yes, you can supplement. In case of severe deficiency, you can have infusions of iron as well.
Yes, exactly.
And then dealing with the cause to kind of stop that blood loss. Zinc, some clinical trials support kind of higher doses of zinc for hair growth. Vitamin D, such a key nutrient to support our immune system and correct some of the immune-related imbalances that drive hair loss. So some of the foods, but also some of the good guys like good supplements and sunshine is
just getting out into the sun. I feel like
sun
it's
is
just
getting
coming
out,
through
which
today.
will give us a little bit more vitamin D soon.
It's nice. It's that balance of the good factors and the bad factors. It's not just about taking everything out. It's also about putting back in, and I think that's really key with whatever it is that we're sort of talking about. Tell me a bit about sexual health, because that's something that we're also discussing today. Is that something that you can sort of support your clients with through natural means?
Yeah, so I support people, women on their fertility journey, and sexual health kind of directly relates to that. And when we often talk about our kind of gut microbiome, which needs to be very diverse and got various types of microbes and other species in it, but also there's vaginal microbiome. It's much less diverse.
We have a microbiome everywhere, like gut,
skin, oral microbiome.
Yeah, that's so true. Eyes.
Yeah, exactly. So it's very important to maintain vaginal microbiome for fertility, but also kind of to avoid some opportunistic infections like Candida, for example.
Yeah, exactly.
So I work with my clients to restore the microbiome.
Is that through sort of the herbs and the teas and things?
Yeah, so they might have kind of gut infections that's driving it. They just might have less diversity or less of those lactobacillus species. So some kind of vaginal probiotics as well. That can support. And then also there can be some painful conditions like endometriosis, for example, causes pain during sexual intercourse. So I'd work, to correct that imbalance and help people with the pain that they're living through.
And is it really just sort of as a byproduct of women sort of being supported on their fertility journey, or do you find this sort of coming through as we approach perimenopause, menopause, things like that?
Yeah, I think healthy vaginal microbiome is key for everything.
Yeah, exactly, from day one.
Yeah, so there are specific studies that support, certain ratio of lactobacilli for healthy fertility. But at the same time, there are a lot of microbial infections that can go into overgrowth, like Candida, bacterial vaginosis, and a few other things. So having healthy flora in our vagina is helpful to keep those infections at bay.
And is it just something that somebody has to see you as a practitioner? Are there things we can do at home? Again, sort of herbs, supplements, foods that we can be eating, foods that we can be avoiding?
Yeah, I mean, I would advise against kind of self protocols because
don't try this yourself at home.
So people do like vaginal.
We'll be like mashing up like nettles in our kitchens.
Yeah, putting garlic into your vagina. I would be not a huge fan of those homemade things. And vaginal douching is also really bad because it kind of flushes out. Your good guys.
Yeah, exactly.
Yeah, so certain things that people research on the internet and then they kind of self-prescribe and things go wrong.
I think that can happen with everything, isn't it? You must see it for skin and sort of body, and you never want to sort of be trying too much yourself under your own guidance. Yeah,
I mean, I always advocate for using food as medicine, and I would post some recipes where you can forage things like nettle and a few other things and make dishes and not even think that you're taking medicine, but just incorporating it into your daily life. So things like that are great, but if you have a proper condition, it's better to see a specialist.
Yeah, agreed. I think that is like a really good note to end on with this talk in general. See a specialist, don't try anything yourself in your own kitchen at home. Thank you so much, Jenya, that was super interesting. And thank you everyone for being here. It's been super interesting for me. I hope it has been as well for you to listen to our amazing panel today. I think they've all sort of really highlighted that obviously what we go through as women is not a walk in the park, but actually to Jenya's point, actually sometimes these things are worth celebrating. And I think sometimes if we reframe these periods of and chapters of time in our lives, then that's a really powerful medicine. And otherwise, it's very much about acknowledging the supportive practitioners who can help, the amazing therapies, and I guess just options as well, knowing what is out there for us and educating ourselves. Were you about to say something? Oh no, sorry. I felt like you turned to me, so I didn't want to interrupt. I don't know if anyone has any questions. If you do, just pop up your hand and we can come to you. We'll also sort of be hanging around for a little bit afterwards, so if anyone has more of a one-to-one question on this subject, then I totally get that as well. Were there any questions before I move on? Oh, yes.
So collagen, keep hearing lots of things.
Stole my question.
I've been reading about how all this digestible stuff is rubbish, and actually there is no way of ingesting collagen working.
And are we weighing it out, sort of thing? I'm just
Yeah,
going to
or
move my
does it
chair
just
back.
break up in the gut before it actually
There
does
are actually
anything?
some
Or there's
studies
some that
now.
works.
Yeah. So again,
Good question.
when something can't be patented by a drug company, research is never as strong as it is on a medication that they can make billions from. Now, there are some studies on collagen that are proving a positive beneficial relationship, but there are certain things you need to look out for. One is the dosage. So the clinically proven dose is 10,000 milligrams. The other thing is if you take just collagen, you may as well just eat a steak. So hydrolyzed collagen peptides mean that the collagen's broken up into kind of absorbable chunks that are absorbed unaltered through the gut lining. And of course, the right supplements also need to get to where they can be absorbed. So there are certain things to look out for. Is taking a collagen supplement suddenly going to give you the collagen levels you had at the age of 25? No, no way. But do I think it's a useful thing to do alongside having treatments that stimulate collagen, using products that stimulate collagen? Absolutely. So as part of an all-round collagen boosting regime, brilliant, but they're not a magic fix on their own. They can be great for people suffering with hair issues, joint problems, although the size of particle is slightly different for joints than it is for skin and hair usually. But I personally take them every single day. I actually take 2 different ones.
What form do you take?
A bovine and a marine I take, actually,
Okay.
which are the 2 that have the most evidence.
Yeah. One in the morning, one at night?
I take
Both.
both. Well, I take one. So the key thing is habit. So
The consistency of anything.
So for me, I have one which I take as a powder, and again, they've done the studies to show that putting it in your coffee, so the heat, which was my concern, doesn't denature it. So I take one that's by my coffee machine, and I heap a teaspoon of it into my coffee. Then I take another one which lives in my fridge, which I'll be honest, I'm less consistent with because I don't always go in my fridge in the mornings.
That's so clever having it next to a coffee machine. The one thing you would definitely, without fail, do every day.
Exactly. So that I think is the most important thing. But it's if people are expecting a miracle fix, it's not going to happen. But can it be a supportive part of another journey? Yes, absolutely.
Question up there?
So when you say about supplementing topicals that have collagen, do you recommend any in particular?
Sorry, so for
Topicals,
the
like products to use as opposed to
for
treatments?
skincare or for
collagen.
collagen. So topical ingredients that stimulate, the big one is retinoids. Now not everyone will tolerate a retinoid. And retinoids, once upon a time, everyone thought, oh, if I go and use a retinol, I'm going to go red, I'm going to go flaky. Actually, that really doesn't have to happen with modern formulations. And there are some that I just adore, very clinically evidenced, lots of research on, but without being irritant. The key thing to remember, if you're very sensitive or if you have a skin condition like rosacea, maybe focus on other things, but most other skin types can tolerate retinol. Just increase it gradually. Don't go in at the strongest. It's not more is more.
You have to build up. Is it true you have to build up a bit of a tolerance?
Most people do.
Yeah.
There's one particular one by a brand called Skin Better Science, the Alpha
love that
Ret
one.
Me too. It's one of my hero products, the Alpha Ret Overnight Cream, and that one, most balanced skin types can go straight into using every night without an issue, and then they have a more intensive version once you've gone through a bottle of that. But there are some, again, rosacea prone skin types might be lucky to use a retinol once a week.
Yeah.
And that's okay if that's what your skin can take. So again, to your point, expert advice. For me with skincare, have a consultation. It's so worthwhile getting the advice of an expert, particularly around the time your skin is changing, something that's going to work for you.
Because also if you overdo it, and I've seen sort of girls go to town with the retinol and thinking, to your point, it's not working more and more every day, and then suddenly the skin is really compromised. And you don't want to be undoing damage. We want to be doing things that support the skin.
Exactly, an impaired barrier, which is essentially what, if you overuse active ingredients, acids, because that's another great ingredient, acids, retinoids, if you overuse them, you are going to have a skin barrier problem, and that can lead your skin to hurt, to be uncomfortable, to be tight, to be dry, to be sore, to be red. And ultimately we are using these things to have healthier skin, but also for our skin to look better. And there used to be an adage of no pain, no gain with skincare. There was a famous dermatologist who coined that. And that's just not true anymore. These things shouldn't make you look worse before you look better, or
That's
feel
so
worse
true.
before you feel better.
That is so true.
It
And
takes
it's so
time
true.
as well.
Yeah.
Like skin
Yeah.
turnover.
Yeah.
I mean, really, you have to give it at least 3 months to see.
It's the same
to,
as we
to
were
say
saying with
given
the
the
hair
product
cycle
a
as
chance.
well. A lot of things
Exactly.
are
A week,
3 months.
does nothing.
No,
Yeah.
it's a full product cycle. I always, when you're starting to commit to new products, and sometimes good products can be expensive. There's no two ways about it.
Exactly.
You do need to be thinking, I need to go through one product and be prepared to reinvest again before I really can judge that, rather than going, a month later, it's not done anything for me.
Yeah, that's so true. I always found this as a beauty editor, a new product lands on your desk, you have to write about it that week. And you're like,
Yeah.
I haven't tried it. I haven't had 3 months.
Exactly.
Question over there.
So I wanted to ask about hair loss, and you said about ferritin and the iron stores being really important. What's the best way to address that really? Is it supplements and which ones?
I would recommend less harsh forms of iron, and again it depends on where your levels are, right? So if you're super low, again sometimes the intravenous infusions might be the best way, and also working with the course and kind of to stop blood loss if it's present, or kind of any other factors that are driving it. Sometimes you can look at supplementation orally. There are types of iron like spatone, for example, which is quite gentle, and there are gentle types of iron with regards to its influence on the gut. However, I would say that if you have a real deficiency, it might not be enough. Yeah, so
And does iron supplementation, you were talking about the microbiome, would it interrupt or
it drives dysbiosis to an extent.
so that's actual supplementation?
Yes,
Oh,
yes.
yeah.
So that's why sometimes taking it intravenously is better, and less harsh on the gut as well.
You offer that here, don't you?
No, here we don't do it. It's kind of a medical procedure, because you might have reactions to it. So there are clinics in Harley Street that do it.
Anything intravenous nowadays has to be done in a CQC regulated premises, so it's quite tightly controlled, and iron infusions in particular have quite a high rate of anaphylaxis compared with other things. That's not something to be worried about, but you want to be somewhere where, should you need emergent medical care, you can have it.
Yeah. Have you ever done IV iron?
In hospital settings, not in my own clinic,
a
actually.
clinic,
It's something I choose. I have done them in hospitals, but it's also, I think, so important to remember that if you've got a low ferritin, there is a reason for it, and addressing that reason. We can put sticking plasters on things, but
Yeah, that's so
actually
true.
there's something driving it, and that needs to be controlled if possible.
Jenya, because your methodology is also about using food as medicine. If you found somebody with an iron deficiency, what sort of things would you be encouraging them to incorporate in their diets?
Well, if somebody is vegan or vegetarian, as much as I love those diets, and then
it's hard, right?
That would be my first kind of
Question
and recommendation to eat red meat.
Yeah, exactly.
Now,
a good steak.
Yeah, steak, liver, all kind of organ meats that are also high in iron. Might have some other issues, health issues, but as a minimum, you need to make sure that there is some dietary intake, because as women we lose. So men, they don't need actually as much iron because their body recirculates it. But because women lose it with every menstrual cycle, we actually kind of need to replenish.
Yeah, it's so true. Do you find things like acupuncture a sort of valuable sort of way to support it?
So, I think acupuncture is great for everything because it kind of facilitates that vital force in the body.
It's all about the blood flow, isn't it, and strengthening that.
Yeah, so it's about chi, which is kind of our vital force, and essentially according to Chinese medicine, if we have too little of it, or if it's kind of stuck in one area and other areas are not benefiting from it, then we can get sick. And so it's about redistributing that energy evenly and increasing it in the body.
Yeah.
And of course, it will improve blood circulation as well. A lot of problems with anemia also linked to malabsorption.
Yes, exactly.
Of iron. So we might have low levels of hydrochloric acid in the gut. We might have Helicobacter infection, which will affect absorption. So acupuncture would be also good for kind of regulating metabolism. So there's so many causes of anemia, and I totally agree. You need to look at that.
What about Floridix? My acupuncturist years ago said I had low iron and put me on Floridix. It tastes disgusting.
So
it goes against everything you prescribe because it's like horrible sugar medicine.
So a lot of iron supplements cause constipation, and that's kind of my biggest issue with it, because they drive this better, but also constipation will exacerbate that issue. That's why there are kind of gentle versions, and also they come with cofactors like vitamin C, for example, which improves absorption of iron.
Yeah, which is why you have to sometimes drink sort of a glass of orange juice at the same time, right?
Exactly.
To enhance absorption.
So Spartone that I mentioned is kind of apple juice based.
Yeah.
But again, it is so weak. So if you have a real issue, I'm not sure that that's going to shift the dial significantly.
So I think it's what you said about vegan and vegetarianism is really interesting. I'm a little bit of everything person generally, but so many people that I've seen over time, I don't know if they feel great when they start the diet, and about 2 years later they start to feel less well, and they don't then link it to the change in diet that they made 2 years ago. But for example, our B12 reserves, they take such a long time to deplete that all of a sudden you can become B12 deficient. Wow. I think it's really interesting because it is such a healthy, the lifespan studies, but you need support.
Yeah, and people make these decisions so quickly
on what you're getting.
But it's the long-term sort of results again.
And having expert support with it.
I think it can be incredibly healthy, especially if you have a chef that would cook for you at home and count the proteins and all of the macro and micronutrients. It can be also incredibly unhealthy if you're eating French fries, onion bhaji, pizza, and some vegans that are doing it for ethical reasons, not for health reasons. They can actually get quite large and super unhealthy and lots of inflammatory foods.
You have to replace it, basically. You have to make sure whatever you take out, you have to replace it.
Exactly. You need to make sure the building blocks are there. And actually, one of the most important building blocks for skin and relevant to our topic of discussion is protein. And actually, vegans would struggle if they're not supplementing, if they're not drinking some protein shake and kind of counting the amount of protein, they will be deficient. You just can't get that. You can't eat that much kind of broccoli and pulses.
It's so true.
Unfortunately, because I'm predominantly vegan actually, so for me it's constant struggle to make sure that my diet is balanced. You need to work at it. It doesn't come easy.
But so you're saying it in sort of hair, skin, and
Exactly.
yeah, hair loss. I hear a lot.
And
being
to do
linked.
with IV replacement of things,
Yeah.
people come and they just haven't linked that lifestyle change they made a long time ago to them with actually what's going on with their
It's
health.
being very conscious, isn't it? If you're making a big shift, I think a lot of us just think, okay, it's healthy. I'm being, it's my New Year's resolution. I'm going to do things differently.
It affects healing after surgery a lot.
Yeah, I bet it does.
And it's
you need the
about,
protein.
you've really got
obviously.
to, whatever you take out, you've got to replace with, it can still be vegan, but you have to replace the nutrients that you take out when you take dairy or meat out, because obviously there are benefits to doing that.
Yes.
But we're still getting nutrients that you still need, and you really have to replace, because actually we see it quite a lot in post-surgery healing when something's slow to heal. If it's down to, not all of it, but you can sometimes trace it back to diet in the run.
Absolutely.
And as Sophie said, 2 years, 5 years. It's a very long-term thing, but you suddenly need a lot more nutrients to heal after surgery.
I remember everyone saying to me, eat loads of protein after I had my C-section, just keep healing. It's what the body needs, those building blocks, like you
and
said.
there are now amazing vegan sources of protein. Like, it's not that we're so limited. Pea protein, hemp protein.
So
There's
true.
some good ones.
Yeah, I feel that any diet is restrictive and has some risks. Keto diets, for example, and so whenever you are kind of implementing new dietary protocols, it's always good to talk to a specialist to understand what supplementation you might need. And in the end of the day, in nutrition schools, we always taught that balanced Mediterranean diet is the best way to go.
Yeah, exactly.
And so balance in diet, that's the core principle, and diversity.
A little bit of everything.
Nutrients.
That's so true. It's very silly. Another question.
Collagen, people often make broths, don't they?
The bone
broths.
broths,
Yeah. There's, obviously the difficult thing, it's so hard to comment on because it's not tested, and one batch of it will be different than another batch, and so there's no uniformity. But as a principle, I think it's good, but you don't know exactly how much you're getting, and we can be a little bit less scientific about it, if that makes sense. So I'll always guide people towards something where we know how much they're getting.
That's true. Were there any other questions?
Just one quick one for Sophie. In terms of skincare ingredients, is there anything else you'd recommend apart from retinoids, ceramides, and for menopausal skin?
So, provided you're not struggling with sensitivity, incorporating some acids can be great. And again, there are acids for more sensitive skin, PHAs. But AHAs for your general skin, not necessarily every day, and as a rule, opposite end of the day to your retinoid. Hyaluronic acid, you kind of can't go wrong with. And often another thing people struggle with is pigmentation. So I think antioxidants are really useful to combat oxidative stress, and again, there is one for everyone. Vitamin C can be so variable and actually is quite narrow spectrum. I'm a big fan of, again, a great one by Skin Better Science that I love, the Alto Advanced, which has got 23 different antioxidants in, and it's also water-based, which means breakout-prone skin can tolerate it better.
Yeah, because a lot of them sometimes are in a sort of oil-based formulation, aren't they? And then you're putting it all over your face, and then you're getting the breakouts as a result.
So kind of, I think as a key pillar, because the most important thing, as I said, is consistency and not to be overwhelmed. Cleanse morning and night, and if you're in the city, double cleanse in the evening to strip the pollution out of your pores. And then using preferably an antioxidant in the morning, some sort of lightweight moisturiser and a sunscreen, and then at night cleansing, a retinol and something ceramide based.
And is Skin Better Science a prescription only brand?
It's a physician only brand, but which means you can't just freely buy it online.
You can buy it via clinics or sort of some yourself, right?
Exactly. And the other brand that I love, which you can buy more freely online, is called Revision Skincare. I think again they're brilliant. They're my two hero ranges at the moment. There are other great ones, they're just the ones that I love.
Thank you.
She's a good girl to ask for skincare, topical ingredient advice. Yeah, exactly. I'd love to see your bathroom cabinet.
Oh, honestly, if you saw under my bed, I've got crates of skincare. Just love it. And some of it I can face sharing with friends and family, and some of it I just
can't. You're like, no, it's all mine, it's all me. Were there any other questions? I'm just sharing notes over there. Okay, I think if there are no other questions, then we'll probably wrap up. I just have to say a very big thank you firstly to our amazing beauty triangle for being such incredible women and for sharing all of their sort of amazing tips and tricks and really sort of deep diving into our subject today.
And thank you for bringing us together.
Always, it was a real joy. If you would like us to connect you with anyone, obviously leave your referral cards. We'll sort of loop you in all afterwards. Don't forget your amazing goodie bag. You don't want to miss it. And I hope to see you at another event really soon. We have more planned for, where are we, February, March, in March. So come. Bye. Thank you.